Do I have your permission to use you as my subject for my head, face, skin, nose, mouth, ear, and neck assessment?
Yes.
Okay. I'm going to start with just your skin. Is even, hair distribution is correct for female. The turgor around the hands is correct. Capillary refills on each finger are less than 3 seconds each. There's no clubbing noted. The nails are firmly attached to the nail bed. No edema noted on any. That way. No nodules or any other skin conditions noted for the arms. May I have your lower leg, please? Nothing noted for the lower leg. Hair distribution is correct for a 33-year-old female. No edema noted anywhere. And turgor for the feet are fine. Capillary refill as far as I can see on the toes are fine. And the toenail beds are correctly affirmed to the toe. Skin on the head, face is intact. Only one little spot from is that a pimple?
Mm-hmm.
Pimple spot there and there. On top of the head is symmetrical and attached good to the cervical spine. No, upon palpation, there's no lumps, there's no bumps through it, no flaking of the scalp, no sores noted on the scalp, and no indentation, no bugs. The hair is smooth, it is not coarse, and no balding noted. Then have you lift your face up, eyebrows are intact and even onto both sides. They're symmetrical, the eyes are symmetrical, no drooping noted for the upper eyelids. The sclera are white. The corneas appear round and symmetrical. The conjunctiva are pink, no drainage noting. Lacrimal gland is being palpated, no drainage. That's fine for that. Eyelashes are properly in place and equal on both eyes. I'm going to do your temporal mandibular joint here. I'm going to do a little pressing. I want you to open your jaw for me. Close. Don't feel no clicking, no crepitus noted. Can you open your jaw again and then move it side to side for me? Now again, no clipping, no clicking or crepitus noted. Alright. I'm going to have you to test some of your cranial nerve reflexes. If you could puff your cheeks out for me. Alright, put it back in and then do pursed lip for me. Get them out there. Alright, smile big. Grit your teeth really tight together. Clench that jaw down.
Mm-hmm.
Hold it down as I try to pull down and open. Awesome. That works fabulous. Alright, then go to getting my thing to check your eyes. I want to see the inside, and we're going to also check to see if there's this red light reflex on you. I'm actually going to turn off the overhead light for a moment. And we had red reflex definitely gone. I'm going to continue to look into your eye to get into the extra structures of your eye there. And everything appears normal in there. You can see the blood vessels and see the inner structures. I'm going to do it again to your other side. You look out here for me. And we definitely have the red reflex going on. And yes. And the inner structures appear to be normal. I'm going to turn back on the light. do a couple eye tests on you. We're going to do this, if I had it, we'd do the Snellen test, which is testing for distance, which is a chart that would be placed approximately 20 feet away. I would have you read from top to bottom. If you ended up reading as your lowest is line 20, then it would mean your vision's 20/20. If I give you something to read, that is called the Rosenbaum test, and that would be testing for your reading and near vision test. And again, I would have you read top to bottom to see that the lowest and smallest writing that you could read. Gotta take a breath in there. All right, next we're going to sit next to you. I want you to cover your right eye. And same my eye. And just tell me as soon as you can see the pen coming into your peripheral vision.
I can see it the whole time.
I can see it from way out there. Oh, you got good peripheral. All right, and again, when can you start seeing it?
I can
From
see it
the
right now.
beginning? Is it about coming up?
I can see it from the very beginning.
Okay, switch eyes for me. Again, where can you see it?
I can see it.
The tip of the pen? And again, the tip of the pen. And one more time.
From the very beginning.
Okay, awesome. We're going to toss them for a moment. And then I also want you just to look straight ahead. Focus on me right here.
Okay.
And follow the pen as I make like an H sign. Awesome. And I now would like you to focus on a dot over there.
Okay.
Your visual accommodations are wonderful. Your pupils are reacting correctly. Now I just want to test for equal and reactiveness for your pupils. I'm actually going to switch the light head on this. Just kind of look right here for me. Very reactive, equal. You're equal on both sides. We'll do this one more time. And you got both eyes reacting at the same time, which is fabulous. Alright, now I'm going to test your nose. Your nose is symmetrical, don't feel any deviations or broken. I'm going to take my tool again and go look just up your nose. I'm not going to put it up in there. No deviations or clogging noted. Are you able to, can you smell that?
Oh, yes.
Okay, we can smell our permanent magic marker. Now I'm going to look into your ears. Alright. This is your right ear. Going to pull back and up to try to straighten the canal. I see your tympanic membrane, which is a grayish in color, and your malleus too. No sericum, no wax noted. Now on Miss Nikki, she already pre-informed me that we cannot do her left ear because her left ear is bothering her. But the outer aspects of the ear are all intact. Do you feel any tenderness? And no inflammation or anything noted there. All right, now I'm going to inspect your mouth. There, lips are fine. Again, I'm going to get my little light source here and look in. We have you look in. There's, oops. look in. And there's your Wharton's duck on both sides. Can I please have you stick out your tongue? Say ah.
Ah.
Uvula is moving. Soft palate has moved up and down. Stick your tongue up for me. There's the other ducks there. The foramen is intact. All teeth look present and good. No sores noted. I'm going to check for your lymph nodes. I'm going to start at the back for your occipital ring, your deep cervical here, your post there, your anterior in here. I know you got your temporal ones there, your pre-articular, post-articular there. You get your submandibular, mantle, and linguinal. And come down here, bring your shoulders in, and flex a little. And I don't feel anything, so you feel fine in that department. I'm going to test for your thyroid and for your trachea. I'm going to push down just a little bit. Trachea appears to be within midline of the throat. No deviations noted. I'm going to come up behind you for your trachea, for your thyroid gland. Right in here. Can you do a big swallow for me? And once again, and nothing felt abnormal for that. Now listen. No brute heard. Listening for the carotid. And no brute heard through there. Alright, we're going to do a couple little hearing tests on you. I'm going to use my little tuning fork here. And I want you to tell me if you, when I place this on top of your head, if you can hear it equally in both ears.
Yes.
Alright, going to do that again to your bone on this side. And there. Alright, for that, I'm also going to have you plug this ear.
Good, how are you?
And the other ear.
Just wonderful, how are you?
I think we have completed this.